Good morning, everybody, and welcome to the UCLA Child and Adolescent Psychiatry Grand Rounds. I have the pleasure of introducing Allison Goodman, who is a UCLA clinical psychology intern in the acute child track and doctoral candidate from Florida International University. In addition to the extensive clinical training that she is obtaining during her internship here, Ms. Goodman has experience in multiple evidence-based treatments, such as trauma-focused CBT, dialectic behavior therapy, as well as administering structured assessments for anxiety disorders and treating selective mutism in school settings. One hallmark of her clinical and research endeavors is a focus on community partnerships to expand reach of mental health prevention and treatment. She has partnered with schools, county parks and recreation departments, and other after-school programs. Ms. Goodman is someone whose research is grounded in her real-world experience in under-resourced public schools through her 4 years of being involved in AmeriCorps' City Year program, an education nonprofit that places bright young adults in some of the most severely impacted public school systems. These experiences have helped shape her understanding of how social-emotional learning can be integrated into public school classrooms and after-school programs to help address racial inequities and barriers to care. Please help me welcome Allison Goodman.
Thank you so much for that wonderful introduction. It's really an honor to be introduced by you, and I'm really happy to be here today. I'm gonna go ahead and share my screen. Okay. And I've been told not to ask the question if everyone can see my slides, so I will not ask that question and we'll just assume. But today I'll be talking about my dissertation. So the title of my dissertation is Knowledge Access to Action, Care Extender Models to Promote Youth Mental Health in Under-Resourced Schools. And I'm really excited to share about this work. It's several years in the making, a minimum of 3 years, maybe a maximum of 11 years in the making, depending on when we start the initial time point. Before we begin I've just been asked to share 2 things with you all, one of which is that I have no financial disclosures to declare, and the second of which is that, as I'm sure you know, there's a Q&A function, so we welcome you to share any questions that you might have throughout the talk. You don't have to wait until the end via the Q&A button, and then hopefully we'll have time for a number of questions at the end. But please do share. It's kind of odd that I can't see everyone, but I know that you're there, and I'm happy to share about this work. Okay, I'm gonna share, just kind of getting us started, why I think that this work is so important and why hopefully I can convince some of you that school-based and community-based mental health care partnerships are so important. This is actually a picture. I've tried to include pictures I've taken over the years. This was a picture I took in a school down in Miami prior to beginning any of this research, but just to kind of set the stage for some of where this work occurred. Okay, so as I'm sure all of you know, there are barriers to accessing mental health care, right? We all see in our clinics, our inpatient units, our PHPs, the people who are able to access care for a number of reasons. However, I think that this is a very small, and we know from the research, this is a very small percentage of the population that's accessing care. And what we do know is that schools are one of the most common sites for mental health care, meaning that just because students spend most of their waking time in schools, one, they become a site for support, just purely support from teachers, but 2, when they do access mental health care, they are one of the 2 most common mental health care sites, and that's along with outpatient settings in the community. That's based on a recent meta-analysis by Duong et al. In 2020. There is a recommendation this is the recommendation of the National Association of School Psychologists, that there should be 1 school psychologist for every 500 students. So that's like the ratio, one school psychologist for 500 students. However, the reality is that that's just not the case, right? We know that we're stretched pretty thin in our school systems and in mental health care. And what we find is that the national average is actually one school psychologist for every 1,500 to 2,000 students or so. What I would see in schools is that there would be a school psychologist who would be assigned multiple schools, 3 or 4 schools. And so they would spend a day at each school. Monday would be at this school, Tuesday at this school, etc., meaning that they have really limited time with their students. Where the work that I'll share was conducted was in Florida, where the ratio is really at the upper end, closer to 1 to every 2,000 students. In California, just so that you know, because that's where we're situated right now, it's about 1 for every 1,000. So it's higher still than the recommended ratio, but it's not quite as high as some of these other states. But it depends on the school district, right, and on particular schools. There are some schools here in California that it's about 1 to every 3,000 students. So there's definitely room for growth here as well. We also know that those school psychologists, despite preferring to spend more time on prevention and on treatment, they're typically spending most of their time on evaluations of students because that's where the highest need ends up being. So what that means is that there may not actually, when we say that there's mental health care occurring in schools, it may actually just be on the evaluation side and less so on the treatment side. And then I think very importantly is that we know that teens from racial and ethnic minorities are more likely to only receive school-based services and receive just less care than their white peers in general. So we know that there are shortages. We know shortages are expected to continue moving forward. So all of this is to say that schools are extremely important for mental health care and they can't do it alone, right? We may need to bolster the supports that occur in schools. I couldn't help but share some of the context, the political context, the socio-political context that it was occurring in Florida at the time of when this research was conducted. So I've just thrown up a few headlines. I'm sure that you recognize some of these headlines. I think it's important to remember that this was kind of the context during which this work was conducted. I think as we're engaging in community engaged research, we see how directly policies can impact students and providers. And I think we need to be aware of these contexts as a field. So I just wanted to put up a slide to represent that. Okay. Care extenders, I love this term. I don't think we use it enough. I think of care extenders as adults who do not have formal mental health training, but whose routine interactions with youth position them to be mental health promoting. So what I mean by that is we're not talking about school psychologists here. We're talking about people who interact on a daily basis with kids who may have potential to support youth mental health, but may not have the training to do so. So that could be teachers, it could be after school coaches, volunteer educators, community health workers, right? There's a lot of people who I think this encompasses. I'm specifically going to be talking about AmeriCorps members, so I'll share more about that in a second. If you've heard of task shifting, I would say working with care extenders and the literature there is very aligned with task shifting, which is the idea that we're increasing human resources by shifting job demands. So a very common example of that is supporting librarians to have access to Narcan at their work, right? It's a slight task shift because that's not necessarily written into their job description. But I like this frame, right? How can we support people who are doing the work already to be mental health promoting? And much of the what we know care extenders is that it relies on evidence-based training and support. Meaning that if we are supporting care extenders to support youth mental health, how can we be sharing those tools with them is through training and support that's based in the evidence. And I just want to share, I think this stat kind of points to the need for work like this. Is that a recent systematic review of mental health interventions that was delivered by community health workers reveals that 72% of the studies of this work were published after 2010, so meaning that it's a relatively new area of inquiry. But I'll also share that most of those studies were conducted in low and middle income countries and not in the US, right? So there's a lot of need for this work, studying this work and conducting this work right here in the US as well. Some of you may be familiar with the Consolidated Framework for Implementation Research, also known as the CFIR. For a long time, when I was just reading about it, I was saying CFIR, and then I learned that that's not the way to pronounce that abbreviation. So it's the CFIR. It was originally developed by Laura Damschroeder in 2009 and has since been a model for identifying potential influences on implementation across the board in dissemination and implementation research. And it points to several domains that influence effective implementation of tools learned in trainings. I'm not going to walk through each one of them just for the sake of time, but I'm just going to point your attention to here intervention characteristics and characteristics of individuals. These are two of the most well-studied domains of the CFIR, and this is really where most of the focus of this work occurred. Okay. I love this term transportability as a way to think through sustained implementation, or what's it gonna take. I think of transportability as kind of like future oriented, maybe as opposed to, or in the same world as implementation, but I think of implementation research as sometimes more like looking over our shoulder behind us, right? What were the barriers and facilitators of the work that we just conducted? But despite the wide application of the CFIR, that model I just showed you, to understand barriers and facilitators, what we know is that sustained implementation remains relatively low. And there's a long documented 17-year problem. This is something that I keep in mind often for our work, right? The 17-year problem is the time that it takes for only 14% of scientific discoveries to inform clinical practice, right? So it was this study here, Chambers 2018, that kind of first shared that statistic, but 14% of scientific discoveries, it takes those 14%, 17 years for sustained implementation. So that's a really small percentage of the evidence base. And I think it points to some additional thinking in this area. So transportability, I think of it as what is needed to translate access to action. I was really inspired by Schoenwald and Hoagwood's paper, 2001, which kind of pointed to transportability science as critical to shrinking this 17-year gap. Okay, so that's all of the why. So I hope at this point I've convinced all of you that working in schools is really important because that's where kids exist, right? That working with care extenders is also important because unfortunately most kids are not getting through our doors for more intensive psychological or psychiatric services. And we need to study how we can better train and support care extenders to support mental health knowledge in schools. So that leads us to the current study. I actually don't think I took this picture, just so you know, I think I downloaded it from Google. Okay. So this study examined transportability, or what is needed to translate access to action to promote youth mental health in natural settings. I do want to share with you my conceptual model. This was the model I was working with at the stage of the research questions. And the research question was, how do provider characteristics and their perceptions of mental health knowledge together relate to infusions of training recommendations into school-based routines with youth? So transportability, as you can see here, it's those perceptions of mental health knowledge really informed by the CFER. Up here is these provider characteristics. So characteristics about the providers themselves. And I think of actionable knowledge as the knowledge that I trained the providers in, and I'll share a little bit about that in a second. And then knowledge action is, what did they use? What did they use in their work? And I see, yeah, so I'll keep it moving, but this is kind of how I was thinking about the work that we were conducting. Okay, this work was in partnership with an organization called City Year, specifically City Year Miami. Some of you may be familiar with City Year because it's across the country. There is a City Year site here in LA. They wear yellow jackets here in LA, so it looks kind of similar. You may have seen City Year folks walking around with yellow jackets. But I think it's really important to share because this work was not developed in a vacuum. It was developed in partnership with City Year Miami in thinking about what they were hoping for their core and how we could support. So City Year is a national AmeriCorps program where AmeriCorps members, and I'll reference them as ACMs throughout this presentation, but AmeriCorps members serve for 1 year. They're between 18 and 24. It's typically right after college where people are taking a gap year, and they serve for 1 year in schools in the city that of their choosing. Sometimes it's the city that they've grown up in themselves, and nationally across the board. Oh, and I'll just say that City Year's mission is to help increase the graduation pipeline, right? And to support young people to stay on track to graduation through math and reading and social emotional learning. Nationally, they serve 234,000 students, of which 90% are students of color, and they serve at 349 schools. I partnered with City Year Miami. So City Year Miami is a local site of the national nonprofit. They serve Miami-Dade County Public Schools, or MDCPS. And MDCPS is now the 3rd largest school district in the country. And during the years of the study, there were about 40 to 45 AmeriCorps members, depending on where kind of at what point in the year you took that number, serving 9 Miami-Dade County public schools that were identified by being low performing or having especially high needs. And what I'll say is that local leadership at the City Year Miami site were especially interested in supporting mental health for the core and for students, as well as social emotional learning more broadly. And I think so much of this work was not actually even like thinking about the research side of it. So I do just kind of want to highlight what the partnership looked like. And it was really about working together and iterative development and feedback from all levels of the organization, down from the core members all the way up to the executive director of City Year Miami. And it's many years in the making. I think the research itself sort of began in spring 2022, where we piloted the training series, but really the work started much earlier than that because we were already partnering for trainings. I would come in to do kind of ad hoc trainings depending on City Year needs. There were a total, I think that this number is, I didn't double check that this is totally up to date at this point, but around 22 trainings that had been in partnership between myself and City Year Miami for the core members about all sorts of aspects of mental health care, such as providing trauma-informed care, and all sorts of different things. And this is just like an example. This was the trunk of my very dirty car, don't look too closely. Just on, part of like this work was also helping kind of build engagement for the training series that I'll share with you all. And so it included goodie bags. So folks registered for the trainings. I made a bunch of goodie bags and folders, training folders that they could use during the training series. And I visited the schools and like tried to build enthusiasm by hand delivering them. But there was a lot of work directly at the schools prior to the actual research part of the series. Okay. I think when we're thinking about method, I do think it's extremely important for us as a field and myself in particular to reflect on our positionality and our theoretical orientation as we approach work like this. And I do want to share with you all just some of how I was thinking about my role at the time as the academic partner partnering with a community organization. One of which is I myself attended public schools in Miami, and I think that that's relevant because it really informed why I was so interested in this work and engaging in this work. Despite attending public schools in Miami, I did attend what were called magnet schools, which were relatively well-resourced schools. It meant I was traveling to get to school, and it was kids from all over the county who would attend these magnet schools. And so I think I had a pretty privileged experience of attending public schools growing up myself. And it wasn't until I served, so I think this is another important part of why I was interested in this work. After college, I myself served as an AmeriCorps member with City Year Miami, and it was when I stepped into Homestead Middle School, which many of you probably don't know, right? And I realized that public schools are distinctly different depending on where they're located and the zip code, right? And I saw the discrepancies that existed between the schools that I attended as a kid, right? And some of the schools that I was then working in as a core member. And just to provide like a small example of where some of this fuel came from for this continued partnership is that when I was my first year working in schools, it was the year that Florida changed to the Common Core curriculum. It was called the Florida Standards in Florida, but the Common Core. And the school that I was working at hadn't gotten replaced textbooks to match the curriculum that was now being expected to be taught to students. And so I was working in a math classroom at the time, and for months we didn't have the new textbooks to match what we were expected to teach. And so this honestly made me angry. It made me passionate about this discrepancy in resources and access to knowledge. And that's what drove me to this work. I think when I'm thinking about my positionality, there's of course many aspects of my identity that are relevant in different ways. Some are more visible than others, but I think most saliently in this work is that I am a white clinical scientist, right? So I would say another white clinical scientist. And part of this work was in partnership with schools where I was one of the only white people in those spaces. And I think that's important for me to say because it's important for us to understand how race and ethnicity do play into how we engage with one another. And I think part of the research questions were about like acceptability and cultural and contextual relevance of the work. And my positionality really does play a role there. So despite having my motivations that I already described, I think it's important to share that piece of my positionality as well. And then I think just my personal values of knowledge exchange are important here too, but I'll share too that I really was driven by a transformative framework, meaning it's a theoretical orientation, which is around applying results to like actual action, right? And like how can we encourage AmeriCorps members and Citier to apply the results to their work? So it doesn't just stop with the research, but how can we use it to execute change? I know I spent a lot of time here, but I do think it's important. Okay, so this was the training. So for the actual study that I'm presenting, that we conducted 4 Zoom trainings to supplement AmeriCorps members at Citier's professional development. It was optional, so Corps members did not need to attend. It was incentivized by like counting towards their service hours. And the idea that was that we were using the triangle, the cognitive triangle that I think everyone here is probably familiar with, right? So the idea that thoughts, feelings, and behaviors are interrelated to one another. And that was kind of the premise for the training series. So I'm very proud of this transition. So I'm going to show you. Ooh, there we go. Okay, this was the four different sessions of the Teach the Triangle training. This is what I called the series. So there was an introduction, and then it was really about the application of the cognitive triangle to these 3 different aspects of Corps member work. So their work with youth, their collaboration with each other and other school partners, administrators, things like that. And then the application of the cognitive triangle to their own self-compassion, right? And their own self-care. That was kind of the frame of the triangle series. We had 21 Corps members who registered for the training series. There were, if you remember, about 40 Corps members serving that year. So that's about 50% of the Corps that registered for the training series. And I wanted to kind of help you visualize what some of this looked like. So these are just some snapshots of what the training looks like. And here's like an example slide. The intent was for it to be very interactive, using gradual release teaching strategies. There were like activities that we were facilitating. So despite it being on Zoom, when I delivered those goodie bags and folders, they were able to use some of these live materials during the training itself. Actually in the goodie bag, I was going to bring it and then I forgot to bring it. We were going to do a little show and tell, but I made like these little cognitive triangles out of popsicle sticks and glued them together. So if you imagine a triangle, and it said think, feel, do on each corner of the triangle, and it allowed them to like use an actual manipulative to be able to engage in the training series. And if we had more time, I would kind of walk you through all the different strategies that we talked about. But if you can think about like different strategies that might exist at think, feel, do corners, we talked about challenging negative automatic thoughts when they're working with different students. We talked about mood monitoring and how they can use that for student check-ins, relaxation strategies, both for themselves, but also for their students, strategies for effective listening, things like that were the content of the training. And the research sample itself, so there were 21 Corps members who registered. They didn't all participate in research, so folks could attend without participating. So the final sample for the research was about 15 consented AmeriCorps members, so a third of the Corps, and that was for both interviews and surveys. I wanted to share, this was kind of the method that I used to collect demographic information. Well, not this method, but the method was an open text box where folks were invited to self-describe their identities, and they were encouraged to include race and ethnicity, country of origin, primary language spoken at home, gender identity, sexual orientation, disability, religion, etc., other salient aspects of their identity. And I thought that was a really helpful way where folks didn't need to self-select into like check boxes, but could describe in their own words. And this is a word cloud that represents some of the most common words that came up. It was generally a fairly diverse sample based on country of origin, primary language spoken at home, sexual orientation, and ability. The sample was majority Black or Hispanic, and then female as well. And then just to share that there weren't significant differences on age and level of education between folks who attended trainings and completed surveys and those who didn't. So we were able to collect some of that information from the entire core. So there weren't any major differences between the sample and non-sample. Okay, I'm not gonna share too much about this, but just so you know that this was really the process for recruitment and informed consent. So folks registered for the trainings. If they wanted to, they could participate in surveys and interviews. They didn't have to. Then they attended trainings after the surveys and interviews. And then after the fact, there were interviews. So there were one-on-one qualitative interviews with me, right? So I could collect some qualitative data. There were quantitative measures. These weren't coded or scored, but were rather encouraged to inspire reflection in advance of training. So this was a qualitative study, but we did collect some quantitative data. We also collected some training generated data. So I think about data, I don't think we think of this as like a traditional form of data typically in our work, but there's so many different forms of data that we can be using as a field, and one of which is training generated data, right? So here, for example, if this were maybe more participatory and I could see all of your faces, I might ask you to engage in the chat, right? And like number of responses in the chat is a data point, right? Or how many questions we get in the Q&A, who are those questions from? All of that I would put into the training generated data category. And so there was lots, this study was really rich in training generated data, more than we knew what to do with. There was attendance data. There were Zoom polls that I was utilizing. There was the chat. And then the final thing that I'll mention is that I also included text nudges. So folks could optionally opt into to me, like reaching out via text to like nudge or cue their use of knowledge between training series. And there were about 12 core members who opted into getting text messages from me, basically. So here's like an example text message. There were lots of emojis. I tried to be enthusiastic, but I also collected some data from that as well. So I would ask some questions, they would respond, and that was a fun source of data. And then most importantly, perhaps, are these qualitative measures. So interviews were 60 minutes. And again, the premise was, what's it gonna take for core members to action knowledge from trainings in their routine interactions with kids? And it was really questions were driven by that CFER model that I showed you early on. And obviously interviews are intended for data collection, but I also thought that they were important opportunities to be able to support core members with any challenges they might be having. This was one-on-one time with core members working directly with students who were trying out the things that we had introduced in training. So I did include a section of the interviews when I was asking about barriers, where we were able to spend some time problem solving some of the barriers that they shared. Okay, this was the data analysis, what we did. It was thematic analysis using a theoretical approach. The codebook was organized by CFER domains, and then I had a team of 3 coders in addition to myself. And this is like the process that I'm happy to answer questions about, but we double coded all interviews and developed codes during this process. This was one of my core members in Miami. Okay, I should mention, so I spent in my positionality slide, So just looking back at this picture, I'm reminded I didn't just serve for 1 year with Citier. I did spend 5 years with Citier prior to grad school. So it was in those 5 years, I was working directly for the organization. So that's really where this work kind of like came from and why I'm so passionate about continuing to partner with the organization. Okay, so this is some of the training generated data just to kind of show you some of the results. And what we have is that there were 19 of the 21 registered core members attended at least one session. Through Zoom polls, we learned that there was a high likelihood that core members were trying to use content from this past week. One of the big barriers was just needing more practice. We heard that a lot, like, I need more practice. There was high engagement in the chat. This is like percent of core members who contributed to the chat in each of the trainings. So highest was actually in the second training, which was the triangles application to students. So I think that that's really where we were learning core members found the most applicability. And then through nudges, we learned that there were lots of opportunities to use the triangle content in their work with kids. And that confidence increased over time. Okay, so this is now some of the qualitative results. And I'm not gonna, I think we learned so much from the study, and I'm excited for it hopefully to be published in the coming months, so stay tuned. But for now, I'm just gonna highlight a few pieces of the work and the results that I think are most important. Related to relative, so we're in the intervention characteristics, so the perceptions of the providers on the knowledge that was presented. Generally speaking, they felt that the content felt useful, felt important compared to maybe some other alternatives that we could have trained them in. They felt overall that the content could be adapted to fit their local needs. We learned that, like, some examples of how they were adapting the triangle content. One example was, for example, for mood check-ins, right? There are lots of ways to do mood check-ins. I presented one way, but we were hearing a lot about how they were adapting that, right? How they were students writing their moods or using one of the recommended strategies. Was their choice about how much the students could then share when they were discussing their mood during check-ins? Was that like in the moment or after the fact? Was it privately? Was it surrounded by friends? Those sorts of things were what we were learning is where core members were adapting the tools. Most of the core members appreciated the simplicity of the content, that it was easily digestible, easy to apply. There were a couple exceptions to that. And then related to cultural and contextual alignment of the training content to their specific school's culture and context, we learned pretty often that some of the schools that core members worked in had a high priority on academics, and what core members would describe as like a deprioritization of mental health based on limited resources. So in some ways, this triangle content felt not aligned, right, with the school culture if the school wasn't prioritizing mental health, right, or was not putting limited resources into mental health care, but not always, right? There were some schools that did really value mental health care, but I will say is that across the board, even when core members perceived that content was out of alignment with their school norms, they appreciated that the content could be adapted to the unique context of their schools. And this piece, I think, is just so important that core members felt like the triangle facilitated perspective taking for students of different cultural backgrounds from their own, which I think is such an important application of the cognitive triangle. Okay. Related to individual characteristics, and I'm going to move through this just a little more quickly. We learned that self-efficacy generally increased over time with exposure in the training content. They also, it depended on their self-efficacy varied depending on whether it was with students, application with themselves, application with school partners. There was varied knowledge about the innovation prior, or the triangle prior to the training series. They had wide beliefs about the innovation, and we learned about their favorite practice elements, where they like to apply the triangle in their work. And then we also learned about their beliefs about the delivery of the training series. So like more about how myself and my co-facilitators were presenting the content, right? Like how we kind of structured the training, were there opportunities for practice? So I'm not going to share all those pieces, but we learned a lot in that area as well. Stress and burnout, as you can imagine, was extremely high across the board for core members working at schools that were really high stress, and they had a lot on their plate with limited pay. For some, it made it harder for them to show up more fully to trainings, but for others, they were able to show up, and it actually made them more motivated to show up to these trainings. High stress either meant that there was a lower likelihood to use content for some people, but for others, there was a higher likelihood to use the content focused on their own self-care and self-compassion specifically. We learned that we learned that identity facilitated perspective taking. I really loved one core member used the quote that they described it as insights into empathy, right? That they use the triangle to have these insights into empathy. And I just loved that phrasing. Some core members discussed identity matching, right? And that idea that if they shared similar components of their identity, that they felt more naturally able to relate to them. And when they weren't shared, or when there were aspects of their identity that were not shared, they felt that the triangle was an aid for perspective taking, right? So if my gender identity or my sexual orientation or my race was different than yours, that's when the triangle became even more helpful to try to understand your thoughts and your feelings and your behaviors, perhaps in a different context. There's just like so much here. One of the core members too brought up this idea that a wellness or some of these like psychological psychiatric tools are associated with whiteness, right? And so how can we as a field think differently about how we're presenting these tools? And they may not be applicable. Some tools may not be applicable, such as progressive muscle relaxation, right? We heard that progressive muscle relaxation requires clenching different muscle groups and relaxing, right? But when you're clenching your hands, it could look like fists, and you can imagine when that might not be appropriate. So we learned a lot from this area, and I think it's having us be really thoughtful about the work. Okay. I know so we have about 5 more minutes before I know I want to wrap up, so we have time for questions. But I'll just highlight here that there were so many examples of how core members were applying or the triangle to their work. So I labeled that knowledge action. How are they actioning knowledge? And that was with students, with their school team and partners, and with themselves. This particular area with students was the biggest area that we heard about. So there's so much potential, I think, for core members and other care extenders to use the cognitive triangle in their work with kids at schools. And they did this in big ways, like really big ways in their interventions and in their classrooms, but also in small ways. And one core member said that they would like sneak it in. And you can imagine maybe what that looks like, how you might use like just a deep breath with a student, as opposed to like totally changing the way that you're leading an intervention. So there's just like so much wonderful content that we learned. Oops. Okay. We learned about facilitators, we learned about barriers, and we also learned about the impact of knowledge action. And I do just want to share here that core members felt overall that the cognitive triangle allowed them to strengthen relationships with their students, that students opened up more, there was increased communication around emotions. And I also want to highlight that there was what was called unplanned diffusion. I love the term diffusion, right? So like dissemination is planned, right? We plan for content to be distributed to core members, but diffusion was that unplanned content to other people that actually weren't sitting in trainings. So I learned that some teachers and other members of the city or team and other administrators who weren't present in training we're using some of the content from training. So that's a really exciting outcome. And I think that there's so much potential to study more systematically that unplanned diffusion. So I could see that as being like a future goal of the work. Mm, I'm just pausing to kind of decide what I want to do with this last little bit of time. I think I've shared some of like my discussion or how I'm thinking about it over time. So I'm gonna zoom forward because I really want to share just a couple of these lessons learned. And then we'll wrap up and leave some time for questions. These are my, like, as I'm reflecting on this partnered work with a community organization in schools that have limited resources and what our roles are as mental health providers and professionals. Like, what are some lessons that we can take away? And I think just to highlight a few, one is it's so important to spend time in community spaces, not for research, not because we're trying to meet some end game, but because our time holds value and there's so much potential of just showing up, right? And in those like in between moments before training or after a school program, right? How we can support in small ways if we just show up to spaces in programs that we're partnered with. I think when we are partnered with organizations, it's important to build meaningful relationships at all levels of an organization, not just with leadership. So that means from the like frontline workers, in this case, the AmeriCorps members, all the way up to leadership levels, right? But there's many managers in the middle too, and it's important to spend time with them as well. I've talked a lot about positionality and our motivations and how why that's so important for us to think about and how implicit bias might affect this work, especially in qualitative research, but also in quantitative research as well. Language matters. I think just to provide a brief example, in this work, I was using at first the language of like flexible thinking, right? Or stuck thinking. That's how we talk about it in psychological science, right? Flexible thinking. But schools are already have a concept like that. And City already had a concept like that. And they were calling it fixed versus growth mindset, right? So by me using a different language, I wasn't connecting with the people and the ways that they're already communicating. So I shifted my language to reflect the language that they were using to kind of describe similar concepts. It's important to bring an asset-based mindset. And then I think this is so important. This is a quote from Carl Sagan. Absence of evidence is not the same as evidence of absence. And I think we often talk about evidence-based practices as, you know, why it's so important to rely on the evidence base. And I'll also just posit that the evidence base is right now incomplete, right? And just because we don't have evidence for a particular tool with a particular population, that doesn't mean it doesn't hold value. And I think as a field, we are still building up the evidence base, especially to include folks who hold more marginalized aspects of their identity. And it's important to consider that and understand that just because we don't have evidence doesn't mean it's not valuable. And I'll just highlight here, we're working on a piece, a few of us at 4 West, shout out to 4 West, Yes, love my Four West people. But I just want to share too that some of what I'm thinking about too at Four West is, we see sometimes people who come in because of the context of what's occurring in the world, right? So with the election, we saw an increase of admissions due to the election. And so I'll say that clinical work and research is political in a way, and I think it is our responsibility as providers in this field to advocate for work that we think is essential and policies that we believe will help increase access to mental health care and reduce some of these disparities that exist. So with that, I'll end with just a quote, which is, I teach the triangle is about putting empathy into action. So the cognitive triangle, and it's at the core of what we're doing. So I'm going to stop. I'll say thank you. And if there are any questions.
Great. Thank you so much, Allison. This was such an insightful presentation. I love your focus on helping us think about ways that we can get out of our office and learn more about the communities we're serving. And it also just made me think your work is, really kind of at the forefront, I think, in thinking about ways that we can partner with schools in ways that are meaningful to them. Because, as you were talking about your intervention, I was thinking about how it would be really interesting to see the impact that your intervention, even that small intervention that you made 4 sessions, right, teaching the AmeriCorps folks, has on things like decreasing disciplinary action in schools, right? Like instead of, sending the kid to the office, you're actually having a conversation like, what's going on? How can I help you? Being more empathetic, right? Learning those just very like what we often take for granted, I think, as mental health professionals, I think is new and novel for other folks that are not in our field, and you're kind of embedding that into their field is can be so powerful. So thank you so much. Um, and we have Dr. Tabwenka saying, wonderful presentation, Allison. How much do you think advancement in technology will improve the 17-year transportability problem? And also she says, Four West loves you.
Oh, thank you, Dr. T. Shout out to my supervisor. That's a really good question about technology. I think in this new world, this work was in the context kind of post-COVID, just after COVID. So we were able to use Zoom and technology in a way that I otherwise might not have thought about. But I think that that's a great question because there is so much more potential reach that we might have by being able to reach populations that are like in different places than we maybe perhaps are situated. I do think it's an empirical question, right, about the role of technology to decrease that 17-year gap. There are probably some risks inherent to that work, right? So I think one of the things that I liked most about this project, right, is that I had relationships with the organization already. I was able to leverage, there wasn't a steep learning curve about what the culture of the organization looked like. I was from Miami, I went to schools in Miami, right? So there was a lot of that like local knowledge that I think is probably lost, right, if we rely too heavily on technology to reach populations that are more unfamiliar to us. But I think we need to weigh those like risks and benefits because the benefits might outweigh some of those risks, especially knowing what we know about the gaps that exist. So thank you so much for the question.
Yeah. Another question is, I wonder if you can speak to some of the next steps that you see coming out of this work. It was a pilot, select AmeriCorps members. What do you see as possible next steps in this research?
Yeah, I've thought about that a lot. I do not want it to end here, right? I think that there's so much potential, and also just thinking about sustainability and how I think there's a perception sometimes that researchers like conduct the work and then leave and the project is over. And I don't want that to be the case here. So when I think about next steps, this particular project was very focused on provider level outcomes. I think that focusing on student level outcomes, as you kind of alluded to, could be extremely beneficial, right? We didn't collect any data from students about how receiving this content directly impacted their mental health, their behavior in schools, things like that. So I think that that could be a great next step. I also think this was partnered with one particular site of a large national nonprofit, but I do think that there's potential to expand, right, and to reach a larger population of AmeriCorps members, either in City Year or other AmeriCorps programs that you might be familiar with, Teach for America, things like that, that work in schools across the country. So I do think that there's a potential for larger reach. We'll see, right? I don't know where this work totally is going, but I do know that I continue to be passionate about supporting care extenders in school. And so I'm excited to see where it goes.
Yeah, and thinking about outcomes too, one thing you might want to explore is the data that schools already collect. So a lot of their administrative data, things that they have to report up to their state. I know here in California, all of our public schools have to collect school climate data.
Mhm.
So, that could relate to your program as well. And those are outcomes that schools care about, right? So they're more, like you made a mention about how in some schools, they were more academic focused. But if you can tie the social emotional learning to academics, to attendance, to school climate, those are all things that schools are kind of required to, pay attention to and that they care about because attendance is like money in their pocket, right? Like the
Totally.
district, is paid by number of, kind of butts and seats. So, really understanding at the organizational level, I think, what schools kind of care about. Obviously, they care about the student, the whole child. But, there are some drivers to where they're going to focus their budget, right? So if you can link like your program to outcomes that they're already measuring,
I
power to you, right?
love
Um, I'm
I love that idea. I love that idea. It's almost like thinking about the different levels of impact and data
yes,
collection. Mhm.
yes, yes. Um, I also wanted to, I was curious if you could circle back to something that you mentioned about how the skills could really impact the workers themselves, the AmeriCorps leaders, members, and whether there was much in the way of application to their own self-care. Because I could imagine that that job is, it's tough just being any teacher, but to be plopped into like some of the hardest hit schools and being a, first year teacher, I just I just can't imagine.
Yeah. Yeah, it came up a lot. I think I struggle with this one a little bit, if I'm being honest, because even in our own work, right? Like sometimes these strategies are really helpful for supporting our own self-care and self-compassion, but also sometimes we just need to remove some of what's on our plate, right? If there's like too much stress and burden. However, I would say that the main outcome that from that particular bucket was around less like the self-care practices, but more around being more compassionate with themselves and patient with themselves in the work and not taking things home. So the triangle was about like, okay, like if I'm noticing that I'm worrying a lot about this one particular student, that it's now disrupting my moments of rest, right? And I'm at home and I'm not sleeping because I'm thinking about this student. I think where I heard the most application was in using the triangle to like think differently so that that worry and stress doesn't impact their like rest time when they're not at work. And I think that that's a pretty powerful outcome.
Yeah, important for all of us.
Yes. Yeah, I need that sometimes still too. It's a
Yeah,
constant reminder.
yes, same. Well, thank you so much. This has been such a wonderful talk and discussion. I look forward to seeing your paper when it gets published and your future work in this area. Thank you so much.
Thank you so much for facilitating, and it was great like seeing everybody, but I'm looking forward to hearing folks' reactions after this. So thank you so much. It was great being here.
Yes. See everybody next week. Bye-bye.
Bye.